Okay, everyone, it is 12:30, so we're going to go ahead and get started. Hello, all. Thank you for joining today. It's my pleasure to welcome you to the PQI Birth Equity Modules Preview webinar. My name is Kaylee Vitek, and I will be operating the Zoom logistics of this webinar and introducing today's speakers and co-authors. When I am not providing tech support for PQI, I'm a project manager for the Massachusetts State Perinatal Quality Collaborative, PINQUIN. A couple of housekeeping items before I introduce today's speakers. This webinar is being recorded and will be posted for free on the PQI website. There will be time for Q&A at the end of the presentations with all the co-authors. So please type any questions you have into the chat and we will address them during the Q&A. Lastly, if you experience any technical issues, please send me a private message. Now it is my pleasure to introduce today's presenters and the Birth Equity Module co-authors. Renée Byfield is the Program Director, co-author, national faculty, and a birth equity coach with the Institute for Perinatal Quality Improvement, or PQI. She is a clinical leader specializing in obstetric and newborn care, and she has diverse experience in nursing leadership, management, teaching, simulation-based education, team training, program development, perinatal patient safety, and quality improvement in hospital, academia, surgical, and ambulatory settings. Ms. Byfield was the 2022 Diversity, Equity, Inclusion Leadership Award recipient at the AWHONN National Convention. Next is Dr. Debra Bingham, who is the Chief Executive Officer for the Institute for Perinatal Quality Improvement, a perinatal consultant, and a retired Associate Professor of Healthcare Quality and Safety from the University of Maryland School of Nursing. Dr. Bingham is working to expand the utilization of implementation science and improvement science theories, frameworks, methods, and tools in an effort to eliminate preventable perinatal morbidity and mortality and eliminate perinatal racial disparities. Next is Dr. Anna Kheyfets Daoud, who has recently completed her MD at Tufts University School of Medicine and is starting her residency in obstetrics and gynecology at New York Presbyterian Weill Cornell Medical Center. She has 8 years of experience conducting mixed methods research on inequities in maternal and reproductive health care, with a focus on qualitative and quality improvement methods. Anna published the first standalone maternal equity safety bundle and assisted the Perinatal Neonatal Quality Improvement Network of Massachusetts in implementing it across the state. Finally, we have Dr. Audra Robertson Meadows, who is a professor and vice chair in the Department of Obstetrics, Gynecology, and Reproductive Sciences at the University of California, San Diego School of Medicine. Dr. Meadows is a board-certified academic specialist in general obstetrics and gynecology, a birth optimizer, and a health systems innovator. Dr. Meadows was a founding director of the Massachusetts Perinatal Quality Collaborative, or PINQUIN, where she continues to lead implementation of patient safety bundles. Dr. Meadows is funded by the National Institutes of Health, Centers for Disease Control, and Robert Wood Johnson Foundation to investigate strategies to address maternal quality and birth experiences. In 2023, she was honored as a recipient of the FACOG Award, FACOG Hale Endowed Annual Lectureship Award, UCSD Inclusive Excellence Award to the Culture and Justice Quorum, and the JOP Achievement Award for Perinatal Quality Leadership. And now I'll turn it over to Dr. Bingham. Thank you everybody, and enjoy the webinar.
So great to be with all of you today. Thank you for making the time to be with us today as well. This is a very exciting time that we now are launching the birth equity modules and to be able to provide you a preview of this exciting course. And we're going to discuss these strategies, what the course includes. And before we jump into that, I'm going to give you a little bit of updates on some of the things that are happening at PQI. So just to remind everyone that our mission is to expand the use of improvement science to eliminate preventable perinatal morbidity and mortality and to end perinatal racial and ethnic disparities. Every decision we make at the Institute for Perinatal Quality Improvement are made to, we ask ourselves, will that fulfill our mission or not? So we are very mission driven, and all decisions go back to whether they will meet our mission or not. Why are we formed? Why did we form the Institute for Perinatal Quality Improvement? And why did we create the birth equity modules? Well, unfortunately, in the United States, we have some very unsatisfactory and upsetting statistics that we're working to change. We're working to reduce infant mortality rates. Our rates in the United States are much higher than many other developed countries. And we have huge disparities in outcomes in our country. So you can see, especially in the South, there are a lot of differences throughout the South and high rates of infant mortality. But every state has opportunities. In fact, in the state of Massachusetts, which has some of the lowest rates of infant mortality, there are sections of our state where those rates are even as high as some of the rates in the South. And so we all want to eliminate these inequities and these that are leading to these preventable deaths. In addition, there are trends of maternal mortality and pregnancy-related mortality ratios in the United States have been going in the wrong direction. Our ratios have gone higher while other countries have seen reductions. So we have a lot of work still to do in order to bring these ratios down and to have eliminate the more than 80% of these deaths being preventable. So I know years ago, anesthesia was the leading cause of preventable deaths in the United States, and they now are one of the lowest causes of death. And they worked very diligently to reduce the preventable deaths, to eliminate those deaths. And we all have work to do in eliminating preventable maternal deaths as well. We also see a huge variation both in infant mortality and in pregnancy-related mortality ratios based on race, ethnicity. These differences between races and ethnicities are not due to any inherent genetic differences. This is due to racism that leads to these differences. So we have communities, we have parts of our country, individuals in our countries that are experiencing a disproportionate amount of preventable deaths, and that adds a whole nother layer of tragedy. And we just recently celebrated Mother's Day, and we know no one can replace a mother, and many of the deaths, there are more than one children left motherless, and that affects communities on extremely deep levels and also affects families for generations. So ending those preventable deaths is a huge priority for all of us. The Speak Up program is one of the ways in which we are working to eliminate inequities in the United States. It's based on the Speak Up acronym and mnemonic. And we have a long-term vision is that all perinatal health professionals in the United States will become Speak Up champions, that there would be this level setting, that everyone would understand some core basic data and information and be able to work together with our action plans to be able to eliminate these preventable deaths. Our long-term goal is by 2035 that Speak Up champions will eliminate perinatal disparities in their organizations and communities throughout the United States. And we'll do this by ensuring that every patient receives equitable care. Renée.
Thank you, Debra. And so part of our overarching plan is to follow this action pathway. And if you see on the slide, there are three major steps that are incorporated on this pathway. Number one, to form a Speak Up committee and sign up for the pledge. also to complete the Project Implicit Race Implicit Association Test Assessment. And that starts with looking within, really, trying to see where you fall in terms of your biases. Also completing the online education, which is Module 1, Why Everyone Must Speak Up, Trends and Racial Disparities. And then step 2 has to do with completing the Speak Up Champion course, which is an 8-hour course that we now offer online and at times in person. Part of the goal of that is expected to be accomplished at the end of the Speak Up Champion course is to set SMARTY goals. And we're going to talk more about that later on during this conversation. And then step 3, to complete the other two online education, Speak Up education, which includes pledging to speak up and also how to speak up against racism. And then also finalizing your Speak Up Quality Improvement Action Plan. Also along the trajectory is to become a Speak Up Ambassador. And as I understand, a lot of you attended the Speak Up Ambassador course that was conducted last week. And also then to apply to become faculty. So this is a very comprehensive plan. As we say, this is not a one and done. And we then also support you by having check-in meetings at least 3 times a year. Next slide, please. So good news. We're quickly nearing 2,000. I thought that we were over 2,000, so I was kind of disappointed when I saw just 2,000, but we are steadily increasing our numbers, which is very encouraging. All over the country, as you see. I love to look at this graphic because it really gives us a great representation of where everyone is located. So very excited about this information. Next slide, please. And then our next Speak Up Champion course, which is a national course, is on June 14th and 21st from 8:30 a.m. to 12:30 p.m. So do encourage your colleagues to sign up for it. Next slide, please. And again, just a little bit more about our modules. As I had shared with you all, we do have a package of 3 Speak Up online modules. We actually offer CNEs as well as continued medical education units as well. Again, those modules are why everyone must speak up, pledging to speak up, and then how to speak up against racism in perinatal care. Next slide, please. Debra?
So we use QI as a strong component of our work, and quality improvement people look for how they can improve themselves. And with that, we took a deep dive and a look into how our program's going. And we have created also an action and learning pathway that includes a lot of the different steps we're guiding the champions and ambassadors through. And to just want to highlight this real quick today is this is knowledge is the first level, awareness, moving to attitudes and behaviors. Obviously, the most important thing is having people change their behaviors. And then ultimately that will help us track our data and see equity throughout the United States. And so we took the time and we've done a major evaluation of all of our of the Speak Up Champion program. And in all of I'm very happy to announce, and we will be having a poster at the upcoming A1 convention where these data will be shared as well. But this is the first time to share these data nationally, is to show that we have been making a difference. In every metric we measured, we have seen improvements, some more than others. And this helps us look at how we could make our course even better. But it's exciting to see that we've been able to increase knowledge. We've been able to improve awareness. We've been able to improve attitudes and also change behaviors. Both actually people report in both personal and professional settings. So we are thrilled with to have those data because we we felt it's important to look at how we could do better. And so I won't take the time to go through what all of these data elements, but just stay tuned. We will be submitting this for publication, and just want you to know that we do take our work very seriously and evaluate ourselves as well. So, and this is really exciting news for us. Now, without further ado, we are going to go into the birth equity module. We just wanted you to see how the module fits within the larger context of all of the other work we're doing. And I'm going to turn the time over to Renée.
Thank you so much, Debra. So again, we are so excited about launching the Birth Equity Module course. We want to present this comprehensive and interactive program, and it really wanted to generate as much excitement among you all who are champions, ambassadors, and faculty, because it is designed to advance health equity in perinatal care. This course is a result of collaboration and dedication from numerous experts and organizations committed to fostering equitable healthcare practices. Next slide, please. So the Birth Equity Modules course offers comprehensive interactive education specifically designed for perinatal healthcare professionals who are dedicated to fostering health equity within their organizations. This course includes 4 web-based modules, each ranging from 20 to 60 minutes in duration. These modules cover crucial topics to assist organizations with creating a culture of equity, tackling inequities in perinatal health, implementing equitable clinical practices, and developing effective strategies for supporting diverse patient populations. By participating in this course, health professionals will gain valuable insights and practical tools to enhance their ability to deliver equitable care and improve outcomes for all patients. Next slide, please. So I'm going to go through the just a brief summary of each of the modules. Again, this course consists of 4 equity-based modules. Module 1, creating an anti-racism statement for perinatal facilities, includes guidance on developing a clear anti-racism statement to foster an inclusive environment, and showcases the 4 A's that are crucial components of an anti-racism statement. Module 2, improving data collection and review by race and ethnicity, incorporates best practices for gathering and analyzing data to identify and address disparities. The aim is to help teams understand the importance of stratifying data by race, ethnicity, and language, aka real data, and a review of quality standards for collecting, analyzing, and tracking perinatal data. Module 3, conducting team and family debriefs with a racial equity lens, has techniques for facilitating team and family debriefs that prioritize racial equity, and reviews how to implement team and family debriefing using an equity lens as standard practice in your organization. Module 4, ensuring perinatal care standards are met for birth equity, provides strategies and practical steps to establish a culture of equity to align perinatal care practices with birth equity standards. Next slide, please. So the course development was accomplished with the support of Massachusetts Department of Health, Massachusetts Perinatal Quality Improvement Network. Their support has been instrumental in development of these modules, and these partnerships have contributed resources, valuable insights, expertise, and support to ensure quality and relevance of the content. Additionally, the PQI PinQuin Birth Equity webinars have served as a foundational resource, offering up-to-date information and best practices that have been incorporated into the modules. The Georgia Health Initiative also supported this project. Peer review has been a crucial component of the development process, with experts in the field rigorously evaluating the content to ensure accuracy and effectiveness. Furthermore, feedback from birth equity module lottery winners, we did have a lottery, has provided practical insights and real-world experiences that have helped refine and enhance the course. Next slide, please. So I am so proud and very honored to be among the co-authors of this course. Again, these are the co-authors listed on the slide, a team of dedicated experts who have contributed their knowledge and experience to this comprehensive educational resource. The team includes leading perinatal healthcare professionals, educators, and advocates who are passionate about promoting health equity. Each co-author has brought a unique perspective and set of skills to the development of these modules, ensuring a rich, multifaceted approach to the subject matter. Their collaborative efforts have resulted in a course that is both informative and actionable, providing valuable tools and insights to advance equitable care in perinatal services. Next slide, please. So this is the course layout. It's designed to guide you through a comprehensive learning experience. Each module is structured to build on the previous one, ensuring a cohesive and progressive understanding of the subject matter. The course begins with fundamental or foundational concepts, gradually advancing to more complex topics and practical applications. By following this structured layout, you will begin a thorough and integrated understanding of the principles and practices essential to achieving health equity. Next slide, please. So this may be familiar to you all champions, right? Our SMARTY goals, and I'm just going to go through this briefly. Each module in the course is to help support efforts towards achieving a SMARTY goal that will help PQI achieve our long-term SMARTY goal, which is by 2035, Speak Up Champions will eliminate perinatal, racial, and ethnic disparities in their organizations and communities throughout the United States. So briefly, S stands for specific. Does the goal clearly state the outcome or aim you wish to accomplish? A specific goal answers questions like, what do you want to achieve? Who is involved? Where will it happen? It should be measurable. Can we track progress and measure the outcome? You want to ask yourself, how will we know we've succeeded? What metrics will we use? And then achievable. Is the goal within the capacity of our program or organization? You want to reflect on, do you have the necessary tools and resources? Are there any constraints? And relevant. Does the goal align with your priorities, the organizational priorities and long-term objectives? You want to consider, how does this goal fit with the overall aims? And then, of course, time-based. Does the goal have a clear deadline and review point for monitoring progress? You want to think about, when do you want to achieve this goal? What are the milestones? And is it a realistic time frame? And then inclusive. Has the goal incorporated input from the population of focus and community partners? You want to ask yourself, who needs to be involved in the planning and decision-making process? And then last but not least, is it equitable? Does the goal address the unique needs and circumstances of different populations? You want to reflect on, how will this goal impact various groups? Are we considering equity in our approach? So using the SMARTY framework, we can set goals that are not only clear and attainable, but also promote inclusivity and equity. Next slide, please. So this course includes handouts designed to reinforce key concepts and provide additional resources for deeper learning. And here's an example on the slide of a handout that is provided in the module. These handouts cover essential topics, offer practical tips, and include activities to enhance understanding. Participants can use these materials for reference during the course and as valuable tools in their professional practice afterwards. Next slide, please. And without further ado, here's our first module. And the first SMARTY goal is by date, and you would put in whatever date would be applicable and the name of your organization or site. We'll form an equity committee that will create and publicly release an anti-racism statement that includes the 4 A's: acknowledge, analyze, action, accountability to ensure racial equity in maternal health. Next slide, please. And here's an example of one of the handouts, another handout of the 4 A's, something that you could print out and perhaps put on a bulletin board or somewhere prominent in your organization. So the process of formulating a robust anti-racism statement necessitates a thoughtful examination of essential components, each contributing to the statement's depth and efficacy. PQI recommends that statements include the 4 A's. Again, acknowledge the history, past, present, analyze impact, action, pledge, signing up for that, and then having an accountability for reconciliation. Next slide, please. And here's another example of exemplars that are incorporated in that first module. This is actually a joint statement from national organizations addressing how systemic racism and discriminatory practices have shaped the field of obstetrics and gynecology. This exemplar highlights the collective acknowledgement of the deep-rooted and far-reaching impact of systemic racism within our profession, underscoring their commitment to accountability and ensuring that discriminatory practices are actively challenged and rectified. Again, this is an example that you can use for your organization as you're trying to accomplish that goal. Next slide, please. So there is interaction throughout the content. Each module is enriched with interactive content designed to engage learners and enhance their understanding. And this includes knowledge check quizzes, matching, information prompts, such as hotspots and flip card activities. This design encourages active participation and practical application of the material. By incorporating interactive elements, the module ensures a more dynamic and immersive learning experience. Next slide, please. And then here's module 2 SMARTY goal, which is by date. Your site will use race, ethnicity, and data review to ensure racial equity in maternal health. Specifically, confirm race and ethnicity is accurately captured in medical records, review all L&D data, unit initiative data, stratifying by race, ethnicity, and create a process to capture during case review whether race, ethnicity contributed to severe maternal morbidity. So this is the second goal. Next slide, please. And here's another example of the interactive content in Module 2. This is an example of a flip card. And a flip card activity is an interactive learning tool, like I said, where users click on or hover over a card to flip it and reveal additional information. And that is demonstrated on the right-hand side of the image on the slide. You see the question was, what are some tools for collecting and storing real data? And so the black writing is the answer to that question, or gives more in-depth response to that question. Next slide, please. And now this is an example of, and you see the red circles on the slide represent what quote unquote hotspots. The hotspot activity in education is another interactive learning tool, and it allows learners to click on or hover over specific areas called hotspots within an image or graphic to reveal additional information, explanations, or questions. This type of activity is often used, again, to engage learners a little further and provide a deeper understanding of subject matter. So I'm going to now hand it over to Debra. Thank you.
Yes, so we include in these modules exemplars, as you already saw the example from module 1. Here's an exemplar from module 2 showing an actual dashboard that also includes information by race, ethnicity. So it also includes run charts, and it's a really nice example of how you can use your data in a data dashboard. We also include exemplars from the literature. We include exemplars from case studies and from work that's being done in PQCs, perinatal quality collaboratives in the country, and departments of health. So you will be provided all types of different types of examples throughout the modules. There are also knowledge check questions, and there are different types of knowledge check questions. This is a fill in the blank question asking if you reinforcing what you hopefully learned in the module that explains like what is real data. And then also, yeah, so those knowledge checks really just help reinforce all the things that you just read. Now for module 3, the SMARTY goal, this SMARTY goal for module 3 is that by such and such a date, the specific hospital will implement tools to apply a racial equity lens to debrief major OB complications with teams and families. And so we include a lot of educational content in order to go help you achieve this goal at your facilities. And one of the ways in which we provide that information is, again, with our knowledge checks. You would have been able to read the content, and then you would have a knowledge check that would ask you to read whether you were able to digest that information. And here's a multiple choice question, an example. Module 4 goes over the SMARTY goal for module 4 is that by such and such a date, this certain site will ensure that maternal care standards are met from a racial birth equity perspective. And so throughout all of the modules, again, we provide practical tips, and also you provide those tips again with specific examples so that you can refer back to those and have those handy. We also, here's an example of the educational content that is provided. This is talking about the racial equity health of a perinatal team. Like, what is the health status of your team's perinatal equity health? So, and what would go into assessing would be looking at equity overall, and that whether the racial equity health of these facilities is contingent on both their capacity to introspectively examine their backgrounds, beliefs, and biases. So giving you specific information that will help you understand this important concept. Also, insights around developing protocols and providing equitable care. There are numerous references throughout the module. So those provide you additional materials that you can look up and read and to further your expertise in this topic. And then at the end of all of the modules, there is a course post-test. And again, those will be true and false, fill in the blank, also multiple choice questions. And so it's a very comprehensive 4 modules that make up the birth equity modules course. Now start thinking of any questions you may have, because we're going to have Q&A in just a minute. I'm going to go over some of the pricing, how you access these modules. First off, I want to mention that paid professional members of the Institute for Perinatal Quality Improvement not only support PQI's mission and help us keep the lights on and keep us going and offer a lot of free education, but they also, you get discounts on all educational products, including the birth equity modules course. And it only costs $44 a year to be a member. And you can email us at info@perinatalqi.org if you want more information, or you can go onto our website and you will see in the menu bar the Join Us tab. And Kaylee just dropped in the chat the link if you wanted to, so that you could have that link handy. Now, if you want to get actually buy the PQI's Birth Equity Modules course, you can go to our store, and when you click on the store, you will actually see the Speak Up Champion, the Speak Up program materials. It's lives within that that set of products, and you would find this course and you would add it to your shopping cart. And we are excited to let you all know, those of you that showed up today will get an additional 20% off the purchase price through June 30th using this this promo code here. Now, I will say, if you are a professional paid member of PQI, you would get, that would be an additional discount. And also to just let you know, if you work in Massachusetts, the modules are free because of all of the grant support we received in creating these modules. And through the end of September, the modules are free to all Massachusetts perinatal health professionals. So in that situation, please email Kaylee and let her know that you would like the promotional code for Massachusetts. Please note that CNE is pending. We should have CNE by the middle of June. You can go in and start the course, just don't finish it until the CNE has been approved. And so we'll let you know, that should be the middle of June. And then you can download that certificate. Again, it is just so exciting to be able to launch this wonderful, amazing course that can help guide the country, can help guide your facilities in achieving each one of these 4 SMARTY goals. And we look forward to hearing your experiences, and we want to now take time for you to be able to ask us your questions. And
Debra, can I actually put a shout out to our co-authors who are in the audience?
yes, we want them to join us
Yes.
on the panel.
Yes,
Yeah.
Dr. Audra Meadows and Dr. Anna Kheyfets Daoud. If you could please just wave or something, acknowledge that you are in the audience. So glad you're here.
And they're going to help us with the Q&A session. So what questions do you have about the modules? I know we went over a lot of information, but would love to hear, or even just reactions, what you all think about this new course.
Well, my name is Jamaica Douglas, and I'll start by saying I'm excited because I took the Speak Up Champion course last March. And, you know, the survey that you guys asked about, like, what is your organization doing to tackle perinatal racism? And I was sadly checking too many boxes that we weren't doing enough. So since then, I started a perinatal health equity task force at our institution to try and gain the perspectives of our birthing person. So this really inspired me last year. So I'm happy to be here again, and I'm looking forward to, you know, taking the course to learn more. So thank you.
Thanks, Jamaica. And I want to make sure we give some time for Audra. Dr. Meadows to say anything she would like to add to what we presented, and then we'll let Anna also say hello and add anything she wants to add.
Good morning for the West Coasters and good afternoon for the Midwest and East Coasters. Very, very happy to see this module in this format, and just really thrilled because I just want to plug in one particular fact, which is when we're doing work in our departments to think about how do we make sure that we have inclusive, excellent care in obstetrics for all patients, or obstetrics and gynecology. People often take the word equity and say that it's nebulous and it's difficult, and they're not sure what that means or how to do it. And I want to point out that these modules wonderfully lay out exactly what we mean. They give clear, concise steps that are concrete and demonstrable in terms of being able to show what progress you've made, and to make sure that everybody is coming along with you by having these messages. And as Renee, began with saying, make sure that you communicate these goals that you're setting through your Smarty Aims publicly. And when we've done that, it makes it very clear what we're trying to target and what we're trying to accomplish. And I think that if we have this tool, or not even I think, I know that with this tool, people can be very successful. So I'm just really thrilled to see this, and just want to continue to applaud Renee and Debra for all of the work moving this forward at PQI.
Thank you. Wouldn't be possible without you, Audra. So thank you. And Anna, one of our co-authors.
I just want to thank Debra and Renee for their dedication to this project and the PQI for many, many years, and Dr. Meadows as well for her dedication to Pinquin and this collaboration. It has been such a wonderful pleasure and honor to participate in all of this work and to see it to fruition. And I'm excited to hear feedback on it.
Yeah, we will be looking at your feedback. So when you take the course, I mean, we constantly look at what people write in, what you say, and then take that to heart and work to make things better. So we have a comment here from Nicole Anderson. Nicole, do you want to come on camera? Do you have anything, or do you want me to just read it here? I'm not, if people can, but I'll go ahead and read it. I don't see you, Nicole. So this is great.
Oh, I'm here.
Oh, good. Nicole,
sorry.
go ahead. Say what
I
you
just
want
wanted
to
to
say.
get that in there and just say thank you, guys. Our team has really been working to offer scholarships on education that our facility leads don't have the funding for. And this is one that I'm so glad that I was able to attend to see, because yes, we will be offering this. So I will be in touch.
Oh, yay. Thank you. And that's in Iowa. So that's wonderful news. Thank you so much, Nicole. And then we had a question from Kristen O'Brien. You asked, in addition to these modules, what kind of work module educations are you providing around gender affirming perinatal care? We try to have all of our modules also be gender affirming in any way we can, but we also have to lean in more in that particular topic and have more information in that regard. So thank you for asking that, and we could do better in that regard as well. So we'll keep working on that. And then Leslie, thank you for your congratulations. So did anyone have any other questions for us today? Kaylee, did you get any questions that came to you directly?
No questions, although Leslie did send me a message. Oh, and she put it in the chat as well, that the goal of reviewing all M&M, including the birthing person and family, should be mandatory at all birthing hospitals and centers.
Mm-hmm. Yeah. Thank you, Leslie. We totally agree. And I loved what Jamika said about there haven't been a lot of resources in this regard. And I will say, when we asked that question on our pre-survey about what are the different facilities that people are work at, what are they doing in their facilities around these 4 areas that are included in this course, most people are saying very little has been done. So I think the other thing that this course does for the country is it helps people realize, have these SMARTY goals help let people know what they could work towards. I think sometimes people feel it gets really nebulous at times and don't really have a clear plan about what they could or couldn't do. Yes, Bonnie.
This is Bonnie Glass from Massachusetts, and I've had the privilege of working with the Massachusetts Pinquin for quite a long time. And through Pinquin and through my role at UMass Dartmouth College of Nursing, I've developed an equity bibliography that's quite extensive. And for which I have all of the references in hand. So if anybody is interested in that, please get in touch with me. And it may be, is it on our website, Kaylee?
Yes, it is.
It is. It's on our website. But if you want to be in touch with me in person, or I mean, by email, and for me to send it to you electronically, I'm happy to do that.
Thanks, Bonnie. Yeah, and then
And it's professional literature. It's things like, and it's consciousness raising. It includes Eudora Welty's pictures of the, Black women in Mississippi in the 1970s. I mean, it's a very eclectic assembly of materials.
yeah, I think there's so much we all have to learn, and so thank you for sharing your resources in this way. Also, Leslie Farrington asked a question: will these modules work well alongside A1's Respectful Maternity Care program? And yes, indeed,
Yes.
most definitely. These goals can work with any program, any work that will push us forward towards equity, to our ultimate goal of equity. Renee, what do you want to add to that?
No, I think you said it all. It takes many hands to do this work and many strategies. So this is one of many, and we will continue to create more because we know that the work is not a one and done.
Great. Given the fact I don't see any other questions coming in, and given how busy you all are, we won't belabor this webinar any further. And we just want to thank you for your time and attention, for being here today, for considering taking the course, providing us additional feedback. And so thank you to the co-authors, thank you to Kaylee, and thank you to all of you. I'll turn it back to Renee.
Yeah, thank you so much for coming. We're so excited, and we can't wait to hear your feedback. As you, most of you know or should know, we really take feedback very seriously in order to grow the program and it to be as effective as possible. So thank you for attending, and have a great rest of the afternoon.
Thank you, everyone.